Do you ever wonder why your heart beats? A human heart has 4 valves: pulmonary, tricuspid, mitral, aortic. Every time your heart beats, blood flows through and out of your heart through these valves. The aortic valve is the last of the 4 valves that blood passes through before leaving the heart to supply to the rest of the body. One of the most common and most serious valve problems is called aortic valve stenosis. The aortic valve leaflets that help with the opening and closing can get diseased sometimes, becoming stiff and calcified. So with each beat, less blood leaves the heart to go out and nourish your body. Over time, the heart has to work harder to pump enough blood out to all your cells. Degenerative aortic valve disease affects over 25% of all patients over the age of 65. Severity of aortic stenosis increases with age, with 1 in 8 people older than age 75 showing moderate to severe aortic stenosis. Patients with aortic stenosis may experience the following common symptoms: chest pain or tightness, feeling faint or fainting, dizziness, feeling tired, shortness of breath, irregular heartbeat, heart murmur. For many people, a routine checkup reveals the first sign of aortic valve stenosis. A doctor listening to your heart with a stethoscope may hear a whooshing sound or an extra heartbeat sound. This is known as a heart murmur. It often indicates valve trouble, but not always. Anyone with aortic stenosis should be further checked with an echocardiogram to determine disease severity and appropriate treatment options. Others do well with medicines that ease the pain of symptoms, but medicines cannot cure valve disease. Did you know only 50% of people with severe aortic stenosis survive if left untreated? Aortic valve replacement traditionally involved open heart surgery. This surgery replaces the defective valve with a mechanical or tissue valve. Advancements in the last decade have opened newer possibilities. Typically, those at high or moderate risk may not be good candidates for open heart surgery. For this group, valve can be replaced through a minimal invasive procedure, TAVR. In TAVR, Transcatheter Aortic Valve Replacement, a valve is placed by inserting a catheter through an artery in your leg or chest and guided to your heart. People usually have an easier time recovering and have less discomfort with this procedure. If you or your loved ones are suffering from aortic stenosis, get prompt medical attention right away.